Garg, and I'm really obliged by the opportunity given to me by Sinex Studio for this presentation on oral health awareness. So I will keep things very basic, and I'll try and make you understand that why oral health is important in our day-to-day life. So first, I'll just introduce myself to you. I am a dentist and an endodontist, and I'm also very closely associated with academics. I run my own dental practice in Sector 61 Noida by the name of Dr. Paradhi's Dental Home. I'm also an RCT, that is root canal specialist at several dental clinics in Delhi NCR. I've also authored about 16 international and national papers which have about 250 citations. I'm also a guest faculty for NEET MDS preparation and a consultant for foreign dental board exams. And I was also a former dental surgeon at ESI Noida. So this is just a brief up about me so that you know who is at the other end. I'm sorry I'm not able to share my webcam with everyone at the moment. There's some technical problem at the moment. So what is it that people notice about you when they first meet you? So there was this survey done by a toothbrush company in United States of America, and these were the results. So it took a lot of people by shock, because most people, that is about 47%, said that smile is the first thing they notice about people, followed by eyes, then the smell of the person, clothes, and then hair. And you can see that there's so much difference in the percentage between the highest rating, which is the smile, and the eyes. But is it only about the smile? Your teeth are much more than your smile. Your teeth help you in chewing, so that proper nutrition, your body can get proper nutrition. Your teeth helps in the development of the musculature of the oral, your mouth, and they also tell you about a lot of diseases which can be detected early on if if your oral health would suggest. Then you can go and visit a general physician, and he'll be able to diagnose certain diseases much earlier as compared to when at a later stage, when it is at a more advanced stage. Diabetes being one of the commonest disease. So diabetes and the gum health have a relationship, in which if the gums are compromised, it would suggest that you might be diabetic, and you can get your sugar levels checked, and you can get sure whether there is a correlation. So in a diabetic, the gum health would be worse, and vice versa. If your gum health is bad, you could be diabetic. Eating disorders. Now a lot of people who have gastric problems, it impacts their teeth, because a high acidity and a gastric reflux can damage your teeth as well. So lot of gastric issues can get diagnosed looking at your teeth. Osteoporosis, Alzheimer's, endocarditis, cardiovascular disease, pregnancy complications. These are all diseases. These are some of the diseases which can be diagnosed early on, or correlated with your oral health. Now humans have two sets of teeth: the milk teeth and the permanent teeth. Now a lot of us think that milk teeth don't have any significance, that they are just you can neglect the health of the milk teeth because बाद में permanent दांत तो आने ही है. But that's not how it works. Milk teeth are basically the trainer teeth. They train the child to take better care of their permanent teeth. Also, they help in the development of the musculature and the jaws, and it also helps in the development of speech and aesthetics. The confidence of a child depends on how good are her teeth, and a lot of these things signify how you will have your teeth at a later stage. So this is what your deciduous teeth do. And at the same time, the milk teeth are smaller in size because the jaws are smaller in children. So they have their own significance. And if at all they get lost at an earlier age, then what happens is the permanent teeth will come in shifted positions and there will be crowding, which would lead to this. You might need orthodontic treatment at a later stage. Your child might need braces. It can complicate the further treatment if the milk teeth are not, if the milk teeth are not kept properly in the mouth, or they are neglected, or they are a lot of time trauma to the milk teeth can cause permanent teeth to be affected. And so this is basically what happens. Milk teeth start developing at in the 4th or the 5th week during your pregnancy. So if any trauma happens during the pregnancy, the milk teeth can be affected, and permanent teeth start to develop about 20th week in the during pregnancy. So anything which will happen after 20th week can affect your permanent teeth. So I have told you about this is the picture which will tell you the names of different teeth. It's very layman. I think most of you would already know what are these teeth called, but this is just for your reference. So the front 4 teeth, upper and lower, are known as incisors. Then there are 2 corner teeth which are known as canine, 2 upper and 2 lower. So there are 4 canines in the mouth of humans, followed by premolars. So premolars are 2 in each quadrant. So there are 8 premolars in the mouth, and then followed by 3 molars. So 3 molars in each quadrant. So there are 3 into 4, 12 molars in our mouth. The last being the wisdom tooth. So wisdom tooth has its own significance, which I'll tell you about later. Now premolar teeth are absent in the milk teeth because the jaws are not big enough to accommodate premolars. So the premolars are absent in the milk teeth. That's why there are 20, 8 teeth less. So that means this is how it has been, this is how evolution has made it. Now I've already told you what is the importance of baby teeth. I've already talked about that they are trainer teeth. They help the child understand the importance of the oral health and development of the musculature, growth of the jaw, and speech development. All these are significance of baby teeth, followed by they also keep the space intact for the permanent teeth. Now, like I already mentioned, if they are lost at an earlier age, then it could cause the permanent teeth to come in a shifted or in a different position than they were intended to come at. So it can cause problems at a later stage, and maybe you would need braces or orthodontic treatment at a later age. So now, why do we have wisdom teeth and why not? So this is a very interesting, it has a very interesting evolutionary history. So earlier on, when in the times of the early man, Neanderthal or Australopithecus, all these early man, that time, since the diet was raw and they didn't have proper cooked food, our jaws had to be bigger for better chewing because they were eating everything raw. But as we've evolved, our diet has become more processed, more cooked, softer. So there is no requirement of the wisdom teeth. So wisdom teeth have become vestigial now. They've become obsolete. They are not required in our mouth because the jaws are shrinking, but the wisdom teeth buds are intact. So that's why in the current age group, patients have a lot of problem with their wisdom teeth and they have to be removed surgically. So that is because there is not enough space for the wisdom teeth to erupt. So this is the problem with wisdom teeth, and down the line the wisdom teeth will become obsolete and the buds will become absent, and maybe in the coming 30-40 years, wisdom teeth are not present at all in the jaws of the human beings. Now these are the parts of the tooth. Now why is this important? Because then only you will understand the significance of dental diseases, which I am going to discuss at in the next slides. So the outermost layer is known as the enamel, which is also the hardest layer of the human body. Now enamel is the protective covering of the tooth. If at all it gets breached, then the decay, then the second layer is the dentine. Dentine is the softer layer, and it basically it's basically to provide nutrition to the tooth, and followed by the pulp. Now pulp contains the blood vessels and nerves. It is the area which causes problem, that is, the pain is due to the vessels in the pulp. Now imagine something which is stuck in a small box, and it is inflamed, it wants to expand. So this is why the tooth pain is excruciating, because the pulp, the vessels in the pulp want to expand because of the inflammation, because of the infection. So that leads to excruciating pain. So these are the significance of the three layers and the most important layers of the teeth. And the part of the tooth which is visible in the mouth is known as the crown. And then there is a small section which is a little constricted than the crown, which is known as the neck, which is this area. This is slightly constricted than the crown, followed by the root. Now root is what is lodged in the bone, and then the bone is covered with gum. So gum and the crown portion is visible in the mouth. The root and the bone portion is not visible in the mouth. So basically crown is only 1/3 of the tooth. So basically 2/3 of the tooth is lodged in the bone. Now I'll be discussing the most common dental diseases, which one being tooth decay, which I'm sure most of you have encountered in your life. Now if the decay starts so decay obviously will start in the outermost layer of the tooth, which will be the enamel. Now in enamel, usually the decay slowly progresses very slowly, because like I told you, it is the hardest layer of the tooth. So in this stage, it is still in a very nascent stage, and it can be taken care of very nicely by the dentist. Now the decay will reach the dentine portion. Now here also it is manageable, but by this time the patient will start experiencing symptoms. The symptoms being sensitivity, cold, hot sensitivity, sweet sensitivity, followed by pain. And once the decay reaches the pulp, then the tooth will become in a completely, it will be excruciating, very severe pain, and then then only root canal will be an option to cure us of the pain. And then if we still neglect the tooth pain and we still let it proceed, then it forms an abscess, pus under the tooth. So then in that case, root canal can be done, but a lot of times the tooth structure becomes so compromised that extraction is the only option left with the dentist. We cannot cure it at that stage. Followed by, after extraction, you might need a fixed partial denture, or you might need a bridge. In layman it's known as a bridge, or you might need an implant. So you also understand that with the neglect, even our cost of procedure is increasing. Something which could have been taken care of by a simple filling or a restoration, that progressed to a root canal treatment, followed by progress to an extraction, followed by an implant. So the neglect is what costs us. Now how does the decay proceeds, and why does decay happen? Now there are sugar in our foods, and there is bacteria in our mouth, with bacteria is everywhere, on the surface of the skin, on the surface of the table, on your laptops. It is everywhere. So it's also in our mouths. Now when we feed on carbohydrates, when we intake any sugary substance or anything which has sugar in it, the bacteria gets food to eat. Now when the bacteria consumes the carbohydrates, it produces acids. Now that acids is the one which leads to decay. Now this is also partially dependent on the quality of our teeth. Now there is some hereditary or genetic component in the quality of the teeth, that a lot of times, and also our environment, also the kind of water we drink, our exposure to the fluoride, a lot of things makes up our tooth quality. The diet we eat, if we are fond of taking soft drinks or fizzy drinks, then our tooth quality will also diminish accordingly. So, and followed by the passage of time. Now passage of time is completely in our control. If we visit a dentist early on, the decay will not be as big as if it's neglected over a period of time. Only in this chart, only two things are in our control, that is the diet and the passage of time. So if we take control of these two things, then we'll be in a situation that we'll be able to take care of our oral health or oral problems earlier on as compared to at a later stage. Now coming on to periodontal disease. Now this is pyorrhea. Now in layman it's known as pyorrhea. Now this also is a bacterial disease, but this happens at the junction of gums and the bone. Now if the food is left at the junction of the gum and the tooth, then it further attacks the bone down, and it leads to bone resorption, which will cause different problems, that the tooth will become mobile and will fall out. This is the sequelae of this disease. So basically, if we leave the food stuck on our teeth, it will produce acids, which can lead to decay as well, but at the same time it would lead to bone resorption. Now when the bone resorption will occur, the tooth will become mobile, because the thing which is holding it in the mouth, the bone which is holding the tooth in the mouth, will start to go away, and it will lead to wobbly teeth, and eventually the tooth will fall out. So these are two commonly encountered diseases, oral diseases, which patients visit the dentist for. Now what are the 10 most important dental tips? Now this is a chart which I often give my patients. So first of all, proper brushing and flossing regularly, which is very important. You need to brush twice for 2 minutes each, and you also have to floss before you brush, so that all the food which is stuck between the teeth is already out, which can be cleaned by brushing further. And and usually after brushing, you don't have to rinse your mouth, but only spit out the paste, and so that the effect of the paste and the brushing stays in your mouth for some time. And obviously you have to brush twice a day and rinse after eating anything. Second is, you need to avoid tobacco, because tobacco can further lead to gum problems. So periodontal problems, the pyorrhea which I talked about, is very commonly seen in people who are tobacco users, people who smoke. Then third thing you need to do is, you need to limit sodas, coffee and alcohol. That is because of the acidic component of these drinks. Now what happens is, bacteria is also producing acids in your mouth by consuming carbohydrates, and then you add on to the acid component by these things. So this is why we ask the patients not to have sodas, coffee or alcohol. Now fourth is, you need to consume calcium and other vitamins. Now calcium makes up our tooth structure. Now calcium will keep the tooth structure intact by maintaining the pH of the oral cavity. Now, like I said, acids, because of acids, the decay further increases and the tooth component starts to dissolve. So, if we are consuming calcium in our foods by drinking good quantities of milk and eggs and everything, so in that case, the pH of our oral cavity is maintained. It doesn't go towards the acidic pH, and the food, our dental health is maintained. Now you need to visit your dentist every 6 months. Now why is this follow-up important? Because earlier intervention will lead to lesser problems at a later stage and also will be more cost effective for the patient. We ask the patients to discontinue the mouthwash after 2 to 3 weeks, because sometimes even mouthwashes leave stains on your teeth. Now 7th is clean your tongue daily. You need to clean your tongue because the tongue is a place which harbors maximum bacteria. Now 8th is always take a healthy diet, balanced diet, all proteins, vitamins, minerals, even carbohydrates should be there, but they should be more complex carbohydrates which cannot be processed by the oral bacteria. Drink more water. More water you drink, there will be more cleansing effect on the teeth, so the food stuck between your teeth will not stay stuck and it will get cleaned. Avoid sugary and sticky foods, because if it sticks to the tooth, then it will lead to decay. So now these are some pictures which will tell you how exactly you are supposed to be brushing. Now you are supposed to be placing your brush at a 45-degree angle, and you need to clean it downwards, the upper teeth downwards. Basically it is so that any food stuck between the gum and the tooth comes out. So if you place the brush like this over the gum area and you bring it down at a 45-degree angle, then anything which is stuck between the gum and the tooth will come out. So this has to be done on all the front surfaces of the teeth, back and front all, and then inner surface also again at a 45-degree angle. Then the front lower teeth and the front upper teeth have to be done like this by placing the brush horizontally against the teeth, and then the chewing surfaces have to be rubbed up and down by the by the brush. So this is how you're supposed to be cleaning your teeth. Now what is the significance of different toothbrushes and toothpaste types? Now usually when you go buy a toothbrush, you'll see that it will be written on the brush hard, medium, soft and extra soft. Now dentists don't recommend anyone to use hard or medium toothbrushes. I don't know why companies continue to manufacture them, but only soft brushes and extra soft brushes are recommended by dentists to all the patients. So please make sure when you go to buy a toothbrush, you buy either soft or extra soft. Now extra soft is recommended for those people who have gum diseases or who have very soft gums, or bleeding from gums is frequently seen with them. So basically, so that it is softer on the gums. So extra soft is recommended for patients who have gum problems. Now significance of toothpaste types. Now usually Colgate and Pepsodent are the recommended toothpastes which are very easily available over the counter. Now then there's other toothpastes like Sensodyne, like Colgate Sensitive, like Thermoseal. So these are better recommended. I mean, these pastes should be recommended by your dentist, because you don't know which one is actually suited for you. So let the dentist decide the toothpaste which you should use. And apart from that, there's another toothpaste by the name of PYORRHOEA, which is basically recommended for your gum health. So let the dentist be the one to take a call for you which toothpaste is good for you, and if you don't see any problems, then you should continue using Colgate or Pepsodent. So yes, so I am. I've given you a brief up about your oral dental awareness. I hope I was able to add to already the knowledge you had about dental health. And so these are the pictures of my clinic, and anyone can visit me at any time. And these are the contact details for my clinic, and I would be really happy to help you in any of your dental ailments or dental problems, or any advices you need with your oral or dental wellness. And yes, so yeah, I'm done for the day. And I'm really again very, very thankful for the opportunity given to me by the Sinex Journal, and I would be looking forward to seeing you all again. And yeah, so thank you so much for the patience and for hearing me out, and have a good day.